7. Todo 7. 7 healthy habits na go na go. Move more, eat right. Ang tamang pagkain at pagkilos ang pundasyon sa malusog na pamumuhay. Ngunit sa Pilipinas, marami pa rin ang hindi nakakakain ng tama at hindi sapat ang ehersisyo. 2 sa 10 bata na wala pang 5 taong gulang ay kulang sa timbang, habang 1 sa 10 bata naman ang sobra sa timbang at obese. Sa tamang diet at ehersisyo, maiiwasan natin ang lumalalang banta ng malnutrisyon at obesity. Maiiwasan din natin ang mga non-communicable diseases tulad ng diabetes, sakit sa puso at stroke. Para tayo'y manatiling malusog sa anumang edad, sundin ang mga tips na to. Gumalaw ng 30 to 60 minutes kada araw. Tangkilikin ang active transport tulad ng pagbibisikleta at paglalakad. O gumawa ng mga aktibong gawain tulad ng paglilinis ng bahay. Kumain ng healthy at iwasan ang mga pagkaing mataas sa asukal, asin at taba. Ugaliin ang pagbasa at pagsuri ng mga food labels. Iwasan ang mga inuming mataas sa asukal tulad ng soft drinks at uminom ng di bababa sa 8 baso ng tubig kada araw. Pag naghahanap ka ng panghimagas, kumain ng prutas sa halip ng mga minatamis tulad ng cake at ice cream. Tara na't labanan ang malnutrisyon at mga sakit. Ugaliin nating mag-move more, eat right, for a healthy Pilipinas. Todo 7. 7 healthy habits na go na go. Be clean, live sustainably. Ang kalusugan natin nakaugnay sa kalinisan ng ating kapaligiran. Kasama rito ang malinis na hangin, ligtas at malinis na tubig para sa lahat. Wastong pagtatapon ng basura at iba pa. Ang hindi wastong pangangalaga ng kapaligiran ay nagpapalala o nagiging dahilan din ng climate change. Lagpas 5 milyong Pilipino ang naaapektuhan nito. Umaabot sa 20 bagyo ang dumadaan sa Pilipinas kada taon. Apektado ang tirahan at kabuhayan ng mga tao. Dulot din ito ang pag-apaw ng mga ilog na nagiging sanhi ng matinding pagbaha. Ang dala nitong maruming tubig baha at iba pang pinsala ay nagiging sanhi ng mga sakit, impeksyon at kamatayan. Kaya sama-sama nating pangalagaan ang ating kapaligiran para iwas sakit at mapanatiling malusog ang katawan. Sundan natin ang mga tips na to. Maglakad o magbisikleta para maiwasan ang paggamit ng mga sasakyang nagbubuga ng usok na nagpaparumi sa hangin at kapaligiran. Bawasan din ang pagkonsumo at pagbili ng mga bagong bagay, lalo kung hindi naman kinakailangan. Reduce, reuse, recycle. Hindi natin maiiwasan ang mga kalamidad, pero kaya itong paghandaan bago pa ito dumating. Magtanim ng mga puno para mabawasan ang pagbaha at gumawa ng survival go bags. Let's be clean, live sustainably. Todo ang kalusugan kapag malinis ang kapaligiran. Todo 7. 7 healthy habits na go na go. Care for yourself, care for others. Alam mo ba na 1 in 5 Filipinos ay may mental health problems? Ito ay ang ikatlong pangkaraniwang health condition sa bansa, lalo na sa kabataan. Ang depression ay isa sa maraming uri ng mental health disorder. At ang Pilipinas ang may pinakamaraming kaso ng depression sa Southeast Asia. Ang mental health kasing importante rin ng physical health. Para maingatan ang mental health mo at ng iyong mga minamahal sa buhay, gawin ang mga sumusunod. Mag-exercise o tumutok sa mga hobbies. Nakakabawas ito ng stress at pwede ka pang humubog ng mga bagong skills. Mag-breathing exercises, tulong pangpakalma. Breathe in for 4 seconds. Hold breath for 7 seconds. And exhale for 8 seconds. Gawin ito 4 times, twice a day. Makipag-connect sa iyong pamilya at mga kaibigan. Ipadama ang iyong pagmamahal sa regular na pakikipag-usap, pag-text o pag-video call sa kanila. Care for yourself, care for others. Pangalagaan ang isa't isa para sa malusog na kaisipan. Todo pito, 7 healthy habits na go na go. Don't smoke, lessen alcohol, say no to drugs. Ang pag-abuso sa alak, yosi at droga ay di lang delikado sa kalusugan ng gumagamit. Nakakaapekto rin ito sa kalusugan at kaligtasan ng iba. Ang problemang ito ay laganap sa Pilipinas at sa buong mundo. Kaya alagaan natin ang kapakanan ng bawat Pilipino para supuin ang adiksyon sa alak, yosi at droga. Gawin ang mga sumusunod. Tigilan at huwag simulan ang paninigarilyo. Lahat ng uri nito ay nakakasama sa kalusugan. Ang paninigarilyo ay sanhi ng mga sakit sa puso at baga. Kahit hindi ka alcoholic, drink moderately. Huwag lumagpas sa 4 na baso ng inuming nakakalasing anuman ang okasyon. Ang sobrang pag-inom ng alak ay masama para sa iyong kalusugan. Kilalanin ang adiksyon bilang isang problema sa kalusugan na maaaring matugunan sa medikal na pamamaraan. Pumunta sa mga drug rehabilitation facilities ng DOH o pamahalaang lokal kung ikaw o ang iyong kakilala ay nangangailangan ng tulong. Tara na! Suportahan ang ating kapwa na magtagumpay laban sa adiksyon. Don't smoke, lessen alcohol, say no to drugs. Tawagan ang Substance Abuse Helpline o Quitline sa mga numbers na ito. Todo pito, 7 healthy habits na go na go. Do no harm, but safety first. Taon-taon, umaabot sa 12,000 Pilipino ang namamatay dahil sa mga aksidente sa kalsada. Noong 2019 naman, kada 13 minuto, may isang Pilipino na pinapatay, pinagsasamantalahan, ninanakawan o nagiging biktima ng karahasan. Ang karahasan at kapahamakan, nagiging sanhi ng mga problema sa physical and mental health at problemang pinansyal. Pwede rin itong humantong sa kamatayan. Pero maaaring iwasan ang mga problemang ito sa tamang paghahanda. Para laging ligtas, tandaan ang mga tips na to. Gawing ligtas ang ating mga kalsada. I-report sa tamang otoridad kung may mga sagabal o sira sa daan. Mag-ingat sa pagmamaneho. Para sa mga nagmomotorsiklo at nagbibisikleta, huwag kalimutan ang pagsusuot ng helmet tuwing babiyahe. Huwag magmaneho kung ikaw ay walang lisensya, inaantok o nasa impluwensya ng alak o droga. Mag-report ng kaso ng pananakit o pang-aabuso sa kinauukulan. Pumunta o tumawag sa Women and Children Protection Unit sa mga ospital ng DOH o sa PNP kung kailangan. Gumawa tayo ng ligtas na kapaligiran para sa lahat. Always do no harm. Put safety first for a healthy Pilipinas. Todo 7. 7 healthy habits na go na go. Practice safe sex. Ang sexual and reproductive rights ng bawat Pilipino ay dapat inaalam, nirerespeto at ipinaglalaban. Ngunit dahil sa iba't ibang balakid, maraming suliranin ang kailangan pang matugunan. Noong 2017, 70% ng lahat ng mga babaeng edad 15 hanggang 17 ay maagang nabuntis. Panahon na para itaguyod ang sexual and reproductive health. Simulan na natin sa mga hakbang na ito. Pag-usapan ng sex sa iyong pamilya. Huwag mahiya. Sa tamang kaalaman, maiiwasan ang di planadong pagbubuntis at mga sexually transmitted infections. Di pa kayo ready magka-baby? Alamin ang iba't ibang contraceptive at family planning methods. Magtanong sa doktor o health worker tungkol sa pros and cons ng mga ito. Tigilan na ang stigma sa sex. Magtanong, makinig, makipag-usap at maging supportive. Let's practice safe sex for a healthy Pilipinas. Todo 7. 7 healthy habits na go na go. Get vaccinated. Noong 2017, isa sa bawat 5 batang Pilipino, edad 1 hanggang 2, ang di nabakunahan kontra tigdas at polio. Isa ito sa mga naging dahilan ng pagkalat ng tigdas at polio outbreak noong 2019. Kaya para sa kalusugan ng lahat, ugaliin nating magpabakuna. Protektahan natin ang mga bata at kabataan sa tulong ng pagbabakuna. Kayang-kayang iwasan ang mga sakit na nakamamatay o nagdudulot ng kapansanan. May bakuna rin ang mga nakatatanda. Kumonsulta sa inyong healthcare worker tungkol sa mga vaccines na nararapat para sa matatanda. Magpabakuna. Huwag matakot. Sa mahabang panahon, ang bakuna ay napatunayan ng ligtas at epektibo. Kaya let's get vaccinated for a healthy Pilipinas!
Kumusta naman ka karong pandemya higala? Nanginahanglan ka ba o kaistorya? Ayaw ka bala ka. Adunay we support service providers nga andam maminaw kanimo. Abri ang atong linya, gikan alas 8 sa buntag hangtod alas 5 sa hapon. Lunes hangtod Biyernes, gawas lamang sa holidays. I-text lang ang DSWD space we support space pangalan /kasarian/edad/rehiyon /mensahe or concern o isend kini sa 0918-912-2813 o tawag lamang sa numero nga 0963-569-1906 alang sa Smart 0945-344-9755 alang sa Globe. Pwede usab sa atong website wesupport.dswd.gov.ph o mag-send sa email nga wesupport.focrg@dswd.gov.ph. Makasiguro mo ang tanang impormasyon nga inyong ipaambit ikonsiderang konfidensyal o pribado.
We listen, we care, we support.
DSWD, katuwang ang mga kapuspala.
Good morning, Caraga region. We are live here again at the Facebook page of DOH CHD Caraga. It's a very beautiful Thursday morning. If you are working from home, just taking a sip of your coffee, you are on your way to work or already at work, this is the best chance for you to catch any informative tips and lessons that we're going to learn today from another speaker that we have invited to join in our activity. So, of course, since this is a live activity, before anything else, I would like to introduce myself again. I'm your host, your moderator for today's live discussion. My name is Cristel Delmar, and together I will be joining you in today's discussion with our speaker. So, of course, since it's October is the mental health month, and we are promoting a healthy Pilipinas, the DOH CHD Caraga initiated this virtual activity to discuss very important topics relating to mental health. And we are trying to promote right here that we wanted all of you guys to be champions for mental health because this is a role that we all have to play. And today is the third day for our mental health series, Advocating Care for All. So in the past days, meron po tayong day 1, day 2. We have invited different speakers discussing various topics. Before I proceed, of course, I would like to invite you and encourage you to please click the share button down on your screen so you can help spread the word and invite your friends to watch our activity today. That will really help. And syempre naman, I would like to say hi to our viewers on Facebook. I think we're having 38 live viewers at the moment and counting. Again, we have friends from GSIS Butuan. Thank you so much. Surigao del Norte College of Agriculture and Technology. Thank you for joining us today. We also have friends from Fatima College of Camiguin. And syempre naman, hello, good morning sa inyong lahat. Again, it will really help if you will be able to click your share button and spread the word to our online friends. It's good to start the day right with information that will help us with our day-to-day activities. So syempre naman, before anything else, since we are on a mental health discussion, we would like to let you know that we have a DOH Historieta helpline, which is available 8 a.m. to 5 p.m. on weekdays. You will see the numbers right on your screen. We have two numbers, Smart and Globe. For our numbers for the Smart, it's 0908-615-8754. For Globe, 0927-230-4885. So maya-maya po lamang we are going to show you right there. Yes, it's now showing on your screen. Those are the numbers that you can dial for the DOH Historieta helpline. Again, everything that you are going to share will be deemed confidential and private. So as we proceed, we are going to do a recap on what happened for the past 2 days. Last day na po natin ngayon, and I'm very excited because every day I'm able to pick up very important facts from our speakers, and which is why I'm very excited to hear our discussion for today. During our first day, we actually discussed managing stress at work. So that's very timely because parang especially with the pandemic right here, every one of us are very challenged with the changes that's happening around us, especially at work. And yesterday on our day 2, we discussed taking care of our mental health during the pandemic. As I've mentioned earlier, it has never been easy. We face drastic changes. So of course, shifting of moods and having so much stress and anxiety, we have to tackle that as well, and that's what we did. Yesterday we discussed the sources of stress particular to COVID-19, and of course the common reactions of people during a crisis, and syempre naman the 12 S's of stress management, which were actually very helpful tips. So as we continue today, excited na talaga ako. I've been interacting with our speaker for the past few minutes before we go live, and I believe that she has a very interesting topic to talk about. Ladies and gentlemen, our topic for today is caring for carers, building one's well-being while serving others. That's very relatable, especially to us who are working every day and being of service to other people. Sometimes it's draining to us. So let's see how we can possibly cope with that. So at this point in time, I know I won't be prolonging your agony anymore. It's very important that you get to know first our speaker for the third day of our mental health series. She is a level 5 mental health and psychiatric nurse specialist who graduated BS Nursing in Cebu Normal College, then the Southern Island School of Nursing, and Masters of Nursing at the Philippine College of Health and Sciences. She started as a staff nurse in the National Center for Mental Health on May 1979 and rose from the ranks. On 2006, she was designated as Program Director of the Mental Health and Psychosocial Support Program, acting both as a responder and as a head trainer up to 2019. She is also responsible for the establishment of psychosocial teams nationwide through trainings on MHPSS, especially here in Caraga. So she has mentioned earlier on that she has been conducting trainings over the past few years here in Caraga. She is also a master trainer on expressive trauma integration, the use of expressive arts in psychosocial support, and has been trained under Israel, Dr. Adelia Gertel Krabel, Tammy Barron, and Team Regan of Lesley University, USA. Also, but now she retired from the government service last 2021 June, but has been continually sharing her knowledge in various topics on mental health. She has celebrated 42 beautiful years of service and teaching. Ladies and gentlemen, virtual applause for our speaker for today, Miss Thelma Barrera.
Magandang umaga po sa lahat. Maayong buntag sa tanan nga mga taga Caraga region or region 13. I have always been professing that your region is one of my favorites, if not my favorite region. Why? No? Because I've been to Caraga region many times, countless times, conducting MHPSS training, and I see the place so beautiful with beautiful people, and most of all, no, yung mga natitrain diha sa Caraga. So I also speak Bisaya, no, because my mother is from Cebu and my father is from Leyte. So although I was born and grew up in Manila. So ang mga na-train, no, I conduct mental health and psychosocial support training. And as I've said, ang mga na-train sa Caraga region are one of the best, no? One of the best in the country. Hangtod karon nagko-conduct sila ng mga activities. So I would like to start sharing my screen, no? And we will start discussing ang topic na na-assign sa ako. It's about caring for carers, no? And as I discuss the caring for carers, I would like to include, no, how to improve our well-being by doing self-care. So can you see my slide now? Crystal, is my slide showing? Okay, so I'd like to proceed, no? So I'd like to ask everyone, no, you may not be able to answer me now, but I'd like you to check in on yourself. Kumusta kayo? Kumusta ka mo karong adlaw? So let's do it as a habit, no? Let's make it a habit to check in on ourselves every time we wake up in the morning. How am I today? So mahalaga magkaroon tayo ng self-awareness, check in on ourselves, no? And then we also check in on others. So we may have different feelings at the start of the day, nagbabago yan at the midday or at the end of the day. So pwedeng mabago-bago yung ating pakiramdam. And then tomorrow we may have the different feeling again. So but what is important is we know, we acknowledge and we recognize our feelings and even our thoughts, no? So how are we? This is another question I'd like you to answer. Maybe in your most comfortable time, no? How are we affected by this pandemic, no? So there's such a thing as a pandemic stress, isang klase ng stress. It may be classified as traumatic stress, but it can stand alone as a different kind of stress, no? It's pandemic stress. This is the first time we're experiencing this in our lifetime, no? So really it's taking a toll on us physically, emotionally, and even psychologically. So ano yung mga epekto ng stress sa atin? Because I would like to present to you the psychosocial effects, no? Pag sinabi nating psycho, it affects our thoughts and feelings, no? And then social naman, it affects our relationship with people and our environment as well. So ito yung mga psychosocial effects. This pandemic has affected our mobility. So we just cannot move anywhere. We cannot go anywhere, no? Because of some health protocols that we limit our movement, no? We stay home, no? Para maiwasan yung spread ng virus or contracting the virus. So we just cannot, yung mga travel goals natin have been put to halt, no? And then even our social life has been affected. We just cannot get along or get together with our friends and even our family kahit malapit pa yan, especially the frontliners and the service providers, healthcare workers, no? You choose to stay in one place and then parang you limit going home, no? Because of fear of bringing the virus to your family, especially if you have vulnerable members of the family. And then milestones natin na been affected, hindi na nase-celebrate ang mga usual special occasions, no? The way we used to celebrate it, but of course, iba naman ang Pinoy, we can still do something about that. We can decorate a part of our house, we can still cook food, pero yung celebration is just within our bubble, no? Kasi natatakot tayo na hindi kagaya na before na malakihan ang mga handaan, no? Birthdays, mga 7th birthday, 18th birthday, and even special occasions like weddings at saka mga town fiesta, 'di ba? So affected na 'yan ngayon. Relationship as well, we may have improved in our relationship because of we stay at home most of the time, so mas maraming oras to bond with our families, no? And then also siguro even if it's done virtually, no, mas na enhance din yung mga relationship. But there are also some negative effect on the relationship part, no? Kasi there has been an increase, I think, a 3% increase in the number of gender-based violence, simply because siguro the perpetrator is home, no? So yan ang medyo negative na effect. And then routine natin has been affected as well. Nabago yung oras ng gising, no? Yung mga work from home scheme, no? And then yung traveling, so limited na yung paggamit natin ng mga public transport, no? Mas nakakatakot. But it is suggested and recommended by experts, no, psychiatrists and stress management guru, that even if our routine has been changed, no, we should still come up with a new routine, because that new routine in that new routine will give structure in our lives, no? Kasi meron tayong nilulook forward the next day, hindi yung kung ano lang yung mangyari, no? And then economy natin has been affected as well, not only among developing or underdeveloped countries, but even, no, yung mga superpowers affected ang economy nila. That's the reason why they ease the lockdown, no? Maiksi lang yung mga lockdown nila. At sa kanila lockdown lang. Sa atin ang daming letra, 'di ba? ECQ, MECQ, GCQ, 'di ba? Sa ibang bansa, they just term it simply as lockdown. So mabilis nilang nafli-lift ang kanilang lockdown because they want to save the economy. So it's a struggle between controlling the spread of the virus and saving your economy. Kasi kailangang mag-open up ang mga businesses, no? So And also job natin, ang laki ng in-increase ng unemployment rate from last year to this year, no? Parang nasa 6.2 million Filipinos na ang jobless, no? Pero ngayon there is again an increase in the employment rate kasi nakakabalik na uli. And we're talking about unemployment and also underemployment, no? Tapos yung health natin has been affected, physical and mental health. That's why we often hear that the next pandemic is the mental health pandemic, and we are seeing that now. But it is always there are efforts to address that, no? So marami mga nagkakaroon ng mga mental health issues, kaya tayo may mga helplines or hotline or crisis hotline all over the regions, no? Na ina-address yan ng iba't ibang agency, particularly the health sector. And then stigma and discrimination usually suffered by those who test positive, no? And even their families, and also healthcare workers and frontliners. Some are stigmatized and discriminated. There have been cases before that they are not allowed to enter ang kanilang mga unit sa condominium, no? We have some cases, reported cases of that, of our employees at the National Center for Mental Health na hindi inaalaw pumasok sa kanilang mga condo unit, which is really not good. And then isolation, lahat tayo nakaka-experience na, no? We are isolated from the rest of the world because of travel restrictions. Ngayon, unti-unti na naman nababalik, no? Because of easing up of some guidelines. And then isolated din tayo from our other family members and even friends, no? So meron talagang epekto on us yan. And of course, immeasurable stress and trauma na nararanasan ng lahat. And no one is spared from the stress and trauma brought about by this pandemic stress, no? Whether you're a male, a female, bata, matanda, no? Mataas ang katungkulan, no? May pinag-aralan o wala, lahat tayo nakaka-experience ng stress and some amount of trauma. So, iyan ang mga psychosocial effects, no? And then, as far as my topic is concerned, so we're talking about caring for carers. So, kahit ano siguro, all of you are here, no? Nandun tayo sa caring profession. Yung work ninyo may not be, but service-oriented, no? We serve people, especially if we are in the academe, we are in the civil service, no? We are civil servants, whether we are in the national or the local level. So lahat tayo ay nagpo-provide ng service. No, we care for people. Nasa caring profession tayo. So stress occurs in the workplace when an employee, so kung kayo ay may mga nasasakupan or you are an employee, I'm sure you can relate to this, no? Stress occurs particularly in the workplace when an employee perceives a situation which is strenuous to handle, mahirap ma-handle, challenging, no? Therefore, it can threaten his or her well-being. Okay? Madali naman siguro yan maunawaan because at one point, no, in our working stage, no, tayo lahat nagtatrabaho na, ay nararanasan natin yan. Naranasan na natin yan at any point, and we were able to. I'm not exempted to that, no. In my 42 years working as a nurse na in an institution. So may mga threat din to my well-being because of some work-related stressors, no? So the job stress, no, okay, that can result, very specific itong stress na to kasi it's job related, can result from our interaction, no, between us and our work, or between us and our coworkers, or between us and our boss, our superiors, no? So doon nagmumula ang mga job stress. So as far as the service providers are concerned, okay? So ito, lalo na yung nasa caring profession, long working hours. So ngayon yung mga health workers ay naka 12-hour shifting, no? So parang dalawang shift lang instead of the three shifts with 8-hour per shift. So ngayon nasa 12-hour shifting tayo with only 2 shifts. So yung long working hours, no? Nag-overtime kahit na yung mga hindi naka-shifting mode, no? long working hours can be a source of stress kasi nakakapagod, overwhelming responsibilities. So yung mga existing responsibilities natin before nadagdagan ngayong pandemic, lack of clear job description. So ano ba talaga ang role ko? Nurse ako pero ang nakuha kong job title sa pinapasukan ko ngayon is hindi nurse related, 'di ba? Or lack of or poor communication or management. So hindi mo alam sino susundin mo, 'di ba? Hindi mo alam, hindi klaro yung utos, but you are afraid to verify, to clarify, so that can be a source of stress. Hearing stories of people's pain and suffering, especially for the healthcare workers, 'di ba? Ang hirap na nakikita mo people dying, people who are in pain, no? And you can only do much. And then exposure to destruction, injury, death, or violence. Even lang seeing yung mga ang tawag doon, numbers, no, on the screen, on Facebook, on ano, ilan ang na-infect, ilan ang namamatay, di ba? Yung nung nag-surge tayo a month ago, yung mga 20,000 plus infection rate, no, number of infected people. So nakaka-overwhelm yon, ilan yung namamatay, no. So ako really, that's how I take care of my mental health. I don't like to look at figures kasi wala akong magagawa doon. So this is one thing that I have control of, yung helping people, no, by sharing some information that I know, no. And then according to the Interagency Standing Committee and also WHO, no, our well-being can be affected talaga. As I've said, yung mga longer working hours, walang adequate resources or protection. Can you imagine last year, no, yung umpisa ng pandemic, na walang PPE ang mga healthcare workers, kaya ang daming nagbuwis ng buhay kasi hindi naman parte ng ating araw-araw na kasuotan ang PPE, 'di ba? But a lot of kind-hearted people came to the rescue and provided the PPE until such time that our organization or our government has provided PPE to our healthcare workers, no. And dealing with COVID-19 related stigma and discrimination, no? And nagkasakit ka na nga, stigmatized ka pa, discriminated ka pa. So it's very stressful. Fear for your own and loved one's safety and well-being, that you are really grateful each morning na buhay kayo, no? Walang may sakit sa inyo. And being confronted with illness, suffering, or death. Na nagkaroon na tayo ngayon ng mass grieving, no, mass grief, no, na we see Facebook has been has become an obituary, no. Nakikita mo yung mga nagche-change ng profile pic and cover photos na nagbablock siya or candle, di ba? Kasi may mga namamatay na kamag-anak, kaibigan, and it's taking a toll, no. It's very stressful on us then, no? In caring for family members or even being quarantined, na ikaw ay naka-quarantine, no? And also waiting for, kaya sa mga prayers namin sa family, we also pray for those who are in quarantine. Hindi madali, no? Because I provide psychosocial support to some of them. And then also those who are awaiting for the result of their swab test. Napaka-stressful niya, no? Para kang nakahang, no, sa limbo. Finding the stories of those you help remain with you after work. Yung umuwi ka na, natutulog ka na, naaalala mo pa yung mga na-handle mo na cases, no? Plus any other stresses na meron na tayo even before the pandemic, 'di ba? Wa na kay kwarta, no? Maglisod na ka sa imong mga finances, no? Tapos may problema pa ka sa imong husband or wife, may mga relationship problems pa. So this will aggravate the existing problems na itong brought about by this pandemic. So that can really take a toll on our well-being, na? So since the topic assigned to me was about caring for carers, how do we take care of those people who take care of others, no? Pwede rin yan, helping the helpers or serving the servers, no? So whichever way you want to call it, but we will now talk about how do we care for the carer. So I was also invited to talk about a similar topic, at ito yung nakita ko kasi, no, these are the mandates na nakikita ko sa private sector. Ang may hawak kasi sa private sector would be DOLE. So merong mga labor guidelines which require employers to implement policies and programs to protect and support their workers, as far as the mental health issues, no, prevention, mental health awareness, prevention, or promoting mental health, so mga ganon, no? And then DOLE also has issued guidelines for the implementation of mental health workplace policies and programs for the private sector. So DOLE ang may hawak noon. So for you na first time lang itong nakita, I hope you'll be able to get a copy of this, access this, no, para we will also consider to implement this, no, in our respective workplaces, or maybe kung hindi ikaw ang nakatataas, advocate this to those who are to the management, no. And for the public sector, as in the government, so civil service naman ang nag-govern sa atin. So in a resolution number 1901265, which is the mental health program for the public sector, and this was done in pursuant, no, to the Mental Health Act. So ang tagal tayo nagkaroon ng approved Mental Health Act, no, napag-iwanan tayo ng ibang bansa. But anyway, mayroon na tayo, no, at last, no. So referring to the Mental Health Act of 2018, and then a year after naman nagkaroon ng IRR, or implementing rules and regulations, no. The guidelines will cover all national government agencies, no, constitutional bodies, government owned or controlled corporations or GACCs with original charters, no, mga state universities. So mukhang pasok ang mga attendees natin ngayon, no, those who are watching us live on Facebook. Mga local government units, yes, LGUs are covered with this, even local water districts, no. So agencies are supposed to allocate and incorporate funds and resources in their annual work and financial plan and budget for the mental health program, no, of their particular organization or offices, no. So merong mandato diyan, okay? For the Department of Health, okay, I'm a part of a core group on mental health and psychosocial support, no, MHPSS po 'yon. And dito magaling ang Caraga region, no, kasi ako yung nag-train diyan. Lahat ng mga provinces ninyo, meron kayong regional teams, and meron kayong mga provincial psychosocial teams, at ang pinaka-active is the Agusan del Norte team, no. Mukhang nandito some of them watching us live on Facebook. Ang galing nila, no. Gumagawa sila as in almost every day, especially on the school, no, school setting. So there's also a department memorandum which underwent revision, no, and at the time of this, I was making the slides. Ang alam ko, it's still for signature, pero baka ngayon na-sign na din siya, no, which stipulates how Department of Health staff can be taken care of, particularly during COVID response, no. In the central office, there are designated mental health focal persons sa mga offices doon. And of course, we're trying to put in place the caring for carers program in the Department of Health, no. And since yung disaster response, emergency response, kasama ang psychosocial cluster, no, which is among the 4 quad clusters or health clusters under the Department of Health. Meron ng deployment protocol, no, na need pa din na ma-revisit at maayos, no. And also I'd like to share with you, kasi ako, I'm a psychosocial care provider, no, since the 1990s. And I sit and then I deploy also teams, no, psychosocial teams in the different disasters. I've been 1990, kaya minsan tinatawag akong disaster queen, no? So, disaster responders, no? Hindi lang sa health, and all funding to disaster ay sobrang So, in mental health and psychosocial cluster, meron kami the provision of dictated by
All right, so I think we are having a technical glitch right here. Parang hindi po okay yung internet connection ng speaker natin. I'd like to check on our speaker. Ma'am Thelma, are you there?
teka ha, check.
No problem. I think I can hear you better now, but upon checking here, your slides are not moving. Can we possibly check on your PowerPoint pa? That way, our guests or live audiences will be able to
Yeah.
follow.
Thank you, Cristel. Hanggang saan ang nakikita ninyo? Hanggang saan ang nakita nyo sa slide ko?
One moment, please. Let us check. While we are trying to resolve this issue, would like to say hi again to our virtual guests. Thank you so much for your patience. Stay tuned lang po kayo. Ma'am Thelma, pwede po bang iset natin yung presentation mode sa PowerPoint natin so that we can see it? Presentation mode po tayo, naka-slideshow po. I'm not sure if I can hear you, if this is... Okay, I can hear you better now.
So, nakikita mo ba?
One moment, let me check with the technical team. Naka-presentation mode na po ba?
I-share ko nga ulit. Sorry.
Yes, please.
I'll share it again. No. So, I'm not
Let's check
sure.
this. Mhm.
I'm not sure until up to what anong slide ang huling nakita, and if you can
Basic
hear
principles po.
me, basic principles.
Yes.
Yun naman. Yeah.
We can see your screen po, but if you can, please click presentation mode.
Ayan, can you see that?
We are seeing the entire screen.
Can you see the entire screen? Is it on a slideshow mode?
Hindi pa
Okay.
po naka-slideshow mode po. Hindi pa po.
Talaga? But how do I do that? I am,
You can see a slideshow button po on the topmost bar.
topmost bar.
Okay, yung slideshow po. Slideshow. And then, from current slide po tayo.
Yan. Can you see that?
One moment. Our team is checking on it po, pero right now, I think we're really not seeing it on our end. But we can have a break to have this fixed kasi sayang naman po talaga yung topic, no? It's very interesting, and I know we're going, our live audiences are now preparing their questions for the open discussion. But regarding this, para po mas maximize natin yung topic, we will be having a short break so we can resolve this issue. Meanwhile, for our live audiences, please stay tuned. If you can follow the DOH CHD Caraga page, so you will be updated once we go back on live. We'll just be having a short break. So stay where you are because hindi pa po nag-end yung activity natin ngayon. We just wanted to make sure that everything's all set before we have our speaker back on air again.
Nasayod ka ba? Nga bisan sa wala pa mahitabo ang pandemya, aduna nay taas nga kaso sa depresyon ang Pilipinas. Sumala sa World Health Organization, ang depresyon nakaapekto sa kapin sa 3 ka milyon nga mga Pilipinhon. Samtang, ang mga sakit sa pangisip mao ang ikatulo nga labing kaylap nga klase sa sakit sa nasod. Kadaghanan sa mga misulay o paghihikog tungod sa kasubo nga dala sa sosyal o biyolohikal nga mga hinungdan. Apan, ang mga sintomas sa depresyon dili dali makit-an o mahibal-an sa ordinaryong pagtan-aw lamang. kasagaran, maalaan lamang kini ug kaguol o dili ba kaha masaypan nga katapol. Ang kahimtang sa pangisip makaapekto sa abilidad sa paglambo sa usa ka tawo ug daghan pa ang wala masayod tungod niini. Ang kadaghanan wala na ngayog tabang tungod sa kaulaw o kahadlok nga mahukman. Mao nga ang pagpasar sa Mental Health Act sa Pilipinas kaniadtong tuig 2018 mo'y usa ka dakong lakang sa pagtubag sa mga kabalaka kabahin sa kahimsog sa pangisip. Aniya ang mga butang nga kinahanglan nimong mahibalaan may tungod sa Mental Health Act. Ginalangkog niini dili lamang ang kahimsog sa pangisip apan ang kinatibuk ang kahimtang sa usa ka tawo. Kinatinguha niini nga maprotektahan ang mga pasyente gikan sa diskriminasyon ug uban pang mga paglapas sa tawhanong katungod. Kini naglatid sa mga katungod sa usa ka tawo nga nangayo og tabang ingon man ni adtong nagatagana sa pag-atiman sa kahimsog sa paghuna-huna. Nanginahanglan kini og pagbansay aron lapad ang mahatag nga serbisyo alang sa kahimsog sa pangisip nga dali, barato ug makabot. Magmugna kini og pundok nga magsiguro nga masunod ang mga probisyon sa balaod. Kinasiguro niini ang paggahin sa mga pondo. Apan, bisan pa man og hapsay ang pagkahimo sa Mental Health Act nga naa sa papel, sa unsang pamaagi kini mapatuman. Ang matag lokal nga panggamhanan adunay mahinungdanong papel niini. Ang matag unit sa lokal nga panggamhanan kinahanglang magmugna sa ilang kaugalingong programa sa pagtagana og mga serbisyo sa kahimsog sa pangisip ug edukasyon alang sa katilingban. Ug isip mga individual, mahimo usab nato ang atong bahin pinaagi sa pagka mas sensitibo sa mga pagbati sa uban ug dasigon sila nga mangayo og profesional nga tabang nga walay paghukom. Mahimo natong undangon ang suliran ug himuon nga mas malipayon ang kalibutan kung kitang tanan magkahiusa. Kung ikaw o kung naduna kay kaila nga nakasinati og depresyon o uban pa mga problema sa kahimsog sa pangisip, mahimong makontak ang musunod nga mga numero.
Hello! Ako si Dan. At ako si Pat. And we're the Yoga Twins! Yay! High five, Pat! High five! Bam! We are so excited to be here today to talk to you about mental health.
Ang health ay hindi lang about our physical health, pero kasama talaga ang pag-aalaga sa ating mental health also.
Together, Pat and I have been practicing yoga and mental health techniques for over a decade.
Lahat ng mga tips and lessons that we'll be sharing through this month ay para sa lahat.
And today, we get to share some of these super easy, super quick, and very doable exercises with you.
Ang unang naming tip para sa mental health ay kailangan natin lahat ng mahimbing at malalim na tulog gabi-gabi. Bakit? Unang-una, pag natutulog tayo, mga muscles natin ay nakakapagpahinga at nire-repair. Bumababa ang ating presyon ng dugo, which is good, at bumabalik ang energy. Pag natutulog tayo, nawawalan din natin ang stress ng araw at ang anxiety natin. Alam niyo ba na pag natutulog tayo, when we dream, susi ito ng pampalakas ng alaala, ng memory natin at kalagayan ng mood. Pero alam din natin na hindi madali makatulog. Kaya panoorin natin si Dan sa isang munting breathing exercise na pwede natin gawin bago matulog for better sleep.
Salamat, Pat! Sana hindi pa kayo nalilito. Ako naman si Yoga Twin Dan. Isa itong technique na ginagamit ko when I teach yoga to my students. And are we ready? Alright. Kung maaari, maghanap tayo ng isang lugar na tahimik, lugar na malayo-layo sa istorbo, para talagang malagay tayo sa mood at makuha natin ang benefits ng exercise. Walang kailangan para gawin tong exercise except kailangan lang marunong kayong bumilang. Hanggang 4 lang naman. So, kayang-kaya. Alright. Magsisimula na tayo. Follow my voice, follow my instructions. Start with closing your eyes. Settling down. Following me. Inhale for 1, 2, 3, 4. Hold 4, 3, 2, 1. Exhale 1, 2, 3, 4. Hold 4, 3, 2, 1. Inhale 1, 2, 3, 4. Hold 4, 3, 2, 1. Inhale 1, 2, 3, 4. Hold 4, 3, 2, 1. Open your eyes. Pwede niyo itong ulitin kung gaano karaming beses na kailangan. Pero ito yung isang simpleng exercise that will help us get a deeper, richer, and more meaningful sleep to help with our mental wellness.
Kumusta naman ka karong pandemya higala? Nanginahanglan ka ba og kaistorya? Ayaw ka bala ka. Adunay we support service providers nga andam maminaw kanimo. Abri ang atong linya gikan alas 8 sa buntag hangtod alas 5 sa hapon. Lunes hangtod Biyernes gawas lamang sa holidays. I-text lang ang DSWD space we support space pangalan /kasarian/edad /rehiyon/mensahe or concern og isend kini sa 0918-912-2813 o tawag lamang sa numero nga 0963-569-1906 alang sa Smart, 0945-344-9755 alang sa Globe. Pwede usab sa atong website wesupport.dswd.gov.ph o mag-send sa email nga wesupport.focrg@dswd.gov.ph. Makasiguro mo ang tanang impormasyon nga inyong ipaambit ikonsiderang konfidensyal o pribado.
DSWD, katuwang ng mga kapuspala.
Hello and good morning once again, Caraga. We are now back on live, and of course, we have fixed the technical glitch that we were experiencing earlier. Thank you so much for your patience. I believe we have 57 viewers joining us on our live here on Facebook. And before we call in again our speaker, I would like to request to please share our live here on your Facebook account so that we can reach more audiences and spread more awareness as we discuss a very, very important topic today. So again, this is the day 3 of the mental health series, Advocating Care for All. October is the mental health month, and we are celebrating that to promote a healthy Pilipinas. And of course, our topic for today, earlier we already started the discussion, so mga kaka-join pa lang sa ating live, our topic is caring for carers, building one's well-being while serving others. We have already discussed a few points earlier with our speaker, and ladies and gentlemen, I'm bringing her back. We have Ms. Delma Barrera.
Okay, thank you, Chris. I'm sorry about that technical glitch. No, as I've said, this is the first time I'm using this platform. No, I'm used to Zoom kasi. So, can you hear me?
Yes, we can. We can hear
Okay.
you very, very well.
Okay, so can we turn off the music now? So I understand hindi nag-show ang mga slides, but you can hear me, no, a while ago. So I'll just be flashing the slides. So I was asking you a while ago that even if you cannot answer now, you answer then yung questions ko. in your uncomfortable time. So I ask you how this pandemic stress has affected you, and I presented the different psychosocial effects, no? And I was told naman by the tech team that you can hear me. So ito yung dapat yung slides when I was presenting the psychosocial effects. And please call my attention if you cannot see my slide or you cannot hear me, no? So ito yung sinasabi ko kanina na yung mga stress in the workplace, yung mga job stress natin, no? Yung mga sources of stress among service providers, ayan. So siguro klaro nyo akong naririnig kanina, no? And then I proceeded to how do we care for the carers? So that's my slide. And ito naman, as far as the private sector is concerned, ano yung mga mandates, no? Which point out that the carers or should be taken care of, no? Yung magkaroon tayo, mag-implement ng mga mental health workplace policies and programs for the private sector, and this is for the government. So under tayo na civil service, so meron din yan, no? May mga issuances din. Memorandum circular mandating all government, national government agencies, constitutional bodies, government-owned or controlled corporations, yung mga GOCCs, even state universities and colleges, local government units, na mukhang yan ang mga audience natin ngayon, and even local water districts. So merong mga mandato how the mental health program should be in place in your respective organizations. And I also mentioned about the Department of Health, no, yung mga DM natin, Department Memorandum, the Caring for Carers program, and even deployment protocol, no? So I think I stop on this slide. I hope you can see na the slide, no? So I was discussing earlier in psychosocial, mental health and psychosocial support, which is one of the health clusters under the Department of Health. Meron kaming sinusunod na guidelines that it was issued by the Interagency Standing Committee Guidelines on MHPSS. So meron mga core principles yun, 6 lang yon, no? And since magaling naman talaga ang Pinoy, we adopted the same principles, the 6 principles. We adopted the same guidelines, but we made it, no, in such a way that we consider yung local context ng Filipinos, no? So it became the basic principles governing good practices in mental health and psychosocial support, no? So it came as an NDRRMC Memorandum 62 of 2017. This was approved in February 2017 after we worked on this for two years, no? So it was approved in full council. Ibig sabihin, lahat ng members ng NDRRMC, National Disaster Risk Reduction Management Council, approve this, no, in February 2017. So anong maganda dito? Kasi dito nakastipulate din yung 6 na core principles na binigay ng IASE or the Interagency Standing Committee, ginawang 14 ng mga Pinoy, no, na expert on mental health and psychosocial support. And what is very glaring here, no, naka-green font naman siya, is the last core principle, which is ensuring the welfare of service providers. Diba? Ang ganda. Wala yan sa IASE guidelines kasi 6 lang sila. So if you notice, meron yung mga resilience-based, tapos meron yung mga, pero nandun pa din yung original na 6 na principles. And the last is ensuring the welfare of service providers. So isa ako sa mga nahilingan, no, to work on this. And really, no, hindi naman isiningit, but we really work na maisama at maging glaring ang pagbibigay pansin sa welfare ng service provider. So hindi tayo, we're not starting from scratch, no? Kailangan lang na malaman natin meron tayong mga mandato for us to be able to do that. And the development and implementation of a workplace mental health policy and program will benefit the health of the employees, whether we are in the government or in the private sector, no? And even mga school setting, no? So this will help improve the productivity of the company and also the well-being of the people working at it, no? So in a way, yung community at large, and that is according to the World Health Organization, no? Okay. So how do we achieve better management with fewer incidents of work stress, no? Kasi yung stress will be a part of our life. Pero kailangan natin ma-minimize ito, no? Importante yung mga stress management program because stress management program will improve the employee morale, no? Ang mga moral ng mga empleyado, no? I conduct stress management workshop together with my former boss, the medical center chief of National Center for Mental Health, in several hospitals, no, and even government agencies, no. And nakaka-improve talaga ng moral ng mga employees if they have stress management workshop, team building, team enhancing activities, no. There will be fewer sick days. Kasi pag nai-stress ka sa trabaho, parang gusto mo na lang mag-leave, no. It could be totoong may sakit ka, no, or you just want to make use of your sick leave. Kasi nai-stress ka na sa boss mo, nai-stress ka na sa workplace mo, even nai-stress ka sa mga kasamahan mo. So you avail of the sick leave. So if there will be stress management programs, there will be fewer sick days, na? And then there will be less employee turnover. Positive company culture. Ayan, no? Provide trainings and wellness programs to help you and your employees learn strategies to best manage stress levels. As I've said, and I'd like to repeat it, stress will be part of our life, no? We have our personal stress or individual stressors. We have our family stressors. And we also have work related stressors. So imagine yourself having all those stressors, no? So at this point, I'd like to check on my audio and my video. Cristel, okay ba? Naririnig ba ako at nakikita ba yung slides ko?
Po. Hello po? Yes, we can hear you.
Okay ba ang audio and video?
Yes, we can see both clearly.
Okay, maraming salamat.
You're welcome
Proceed.
po.
I'd like to proceed. So, we also promote awareness about importance of mental health, no? Alam niyo, that's a positive thing about this pandemic. So, mas naging mas naging aware tayo at mas naging, anong tawag doon, sa mga mental health na mga issues, di ba? Paano ma-promote ang mental health, paano ma-prevent ang mental illness, paano ma-address ang mental issues ng mga tao. So workplace health promotion programs have proven to be successful, no? No doubt about that, no? As they combine mental and physical health interventions. So meron yan sa mga private, meron yan sila mga annual PE na hindi ka makakasweldo pag hindi ka nag-annual PE, which is good, diba? Hindi ka pinopwersa. Pero it's also good for you. And even some government, sa government kasi sa amin, sa hospital, sa amin sa NCMH, yung birthday mo, so yung birth month mo, so you can avail of free medical check-up, no? And then the workplace is an optimal setting to create a culture of health. Okay? Whether you are a health institution or not, no? Kailangan magkaroon tayo ng culture of health in our organization or workplace. Communication structures natin are already in place. Programs and policies come from one central team or office, no? Pwede sa mga pwede it can emanate not only from the boss but from the HR, no? Social support networks are available. So may mga support groups kayo, no? Open ang communication line, no? I appreciate one hospital na pag merong mga nagpa-positive na mga employees, no? Pasok yon sa kanilang GC. Kasama sa GC ang mga top management, even their hospital director or medical center chief. Kinukumusta sila. 'Di ba ang sarap pakiramdam noon, no? I will not mention the name of the hospital, and I hope there are other hospitals who are like that. There are some hospitals as well na merong, lalo na kung merong mga na-train na psychosocial providers, no? Their psychosocial team are working on their teams, are working on the welfare of the the personnel, especially those who are on quarantine, yung mga nagkakasakit, at malaking bagay yun, no? I know and I'm very much aware of that because I am part of the team, no, as their mentor, kasi ako naman yung nag-train sa kanila, even the Caraga region teams, psychosocial teams. So we have a lot of GCs, no, ang dami kong GC. So nakikita ko yung benefit, no, that the people, the employees are taken care of. Employers can offer incentives to reinforce healthy behaviors. Sa amin sa hospital before, meron yung pag nag-lose weight ka may ang laki ng premyo so may mga Zumba everyday in the morning, tas kung gusto mong sumali doon sa contest, di ba nakakatuwa yon, no? And then employers can use data to track progress and measure the effects. So meron mga ginagamit ngayon na mga anxiety and depression assessment tool, no? We use DAS-21, the DASS, no? So, pwede rin yun magamit. It's a self-assessment tool lang naman, no? And action steps employers can take include make mental health assessment tools. Ito yung sinasabi ko, available to employees, no? So, you can ask the Department of Health, Caraga Region, no? CHD 13, for a copy of these assessment tools, and you can use this in your own employees, no? Offer free or subsidized clinical screenings for depression from a qualified mental health professionals, followed by directed feedback at saka clinical referral kung kinakailangan. So you are fortunate in Caraga 13 that there are available psychiatrists there, no? Because there are some region na wala talagang psychiatrist. Kung meron man, isa, dalawa lang, no? And then offer health insurances like PhilHealth with no or low out-of-pocket cost for depression, medications, and mental health counseling. Sa aming hospital, sa NCMH, meron yung malasakit center na yung mga nagpa-positive ay nakaka-receive ng certain amount, no? And then free din yung kanilang mga hospitalization sa COVID facility. Provide free or subsidized lifestyle coaching. Marami na nga yung mga lifestyle coach, no? There are accredited counseling or self-management programs. Distribute materials as brochures, flyers, and videos to all employees about the signs and symptoms of poor mental health and opportunities for treatment. So magandang bagay, no? Yung mga piniplay kanina na video, I hope that can be available to the public, no? Even sa Caraga region lang, no? I hope you'll be able to share that as well, no? Make it public kasi magaganda yung mga piniplay kanina, no? And maybe siguro you can come up with particular for mental health, okay? Host seminars or workshops, no, to address depression and stress management techniques, and this is what you are doing. Sana hindi lang ito nangyayari sa October, no? Almost
Hello po, Ma'am Thelma. We seem to be having a problem with your audio. We can see you and we can see your presentations, pero yung audio niyo po parang meron po tayong problem. Kindly check. We are unable to unmute you. Yes, that's
okay,
great.
ayan. Okay na?
Opo, we are good to go. We can see your presentation.
Ay,
Please put it
thank
on
you
back
again,
open mode.
Crystal. So hanggang saan
You're
kaya ako
welcome.
Saan kaya ako naririnig?
A few
Can you-
seconds lang naman po.
A few seconds lang. Okay. Ewan ko ba, hindi na nga ako gumagalaw eh.
That's fine. I think
Dati
okay pa naman
magalaw
po yung
ako,
live audience
malikot
natin.
ako no? So, hindi na ako gumagalaw. Nililimit ko yung movement ko. So, ayan, like to continue. Yung create and maintain dedicated quiet spaces for relaxation activities. Meron yan meron kayo dapat lugar, no? Possibly yung mga open spaces. Merong dart, no? Merong duyan, merong safe chair, as in safe chair, no? So, pag pagod ka, gusto mo magmuni-muni, you can just sit there, merong coffee, overflowing coffee. So siguro naman hindi yan expensive, no, for the workplace, okay? So pwedeng ganon, no? A dedicated quiet space. You can name it the way you want it, no? Pungko lang yung mga ganyan kasi meron kayong mag-istoryata, no? Provide managers with training to help them recognize the signs and symptoms of stress burnout, no, and encourage them to seek help. Alam ninyo, last week I did an early morning webinar for a nationwide health, ano ba tawag, hindi, HR, no, HR personnel of a BPO, no, of a BPO, yung mga call centers. So very interested sila kasi tumaas ang kanilang attrition rate, no. Maraming nagre-resign, maraming nagkakasakit. So yung mga HR personnel wanted to learn about mental health awareness, mga mental health issues, and even how to perform psychological first aid, no? So pwede 'yon. Para there will always be people within the organization na pwedeng ma-address agad, no? Immediately yung mga mental health concerns, no? Hindi natin pinag-uusapan pa dito ang disorder, mga mental health issues and concerns of our respective employees, no? Give employees opportunities to participate in decision making about issues that affect job stress. So pwede yan sa mga staff meetings, no? Organizational meetings that should come up, no? And then employee training on mental health risk, yung mga work-life balance, which is very important, no? Yung mga bullying, ang bullying hindi lang nangyayari yan sa school, no? I have trained one department, no, isang government, no, national government agency. Alam ninyo lahat 'yon. I'll not just mention. And I was surprised, no, to discover bullying in the workplace. At ang nambubuli, yung mga bagito. Binubuli yung mga dati ng empleyado kasi yung mga bagito na yon ay
All right, so I'm back again. Ma'am Thelma, we actually ended on the part where you were discussing about employee training on mental health. Nawawala na po kasi ulit yung audio nyo. Yes, I can hear you now. No worries kasi a few seconds lang naman po kayo nawala.
Hindi nyo ba pwedeng kayo magbalik?
We can actually unmute you on our end pero hindi po connected yung audio nyo so hindi namin kayo ma-unmute on our end.
Okay. So just call my attention, no. So ayun, I was saying na that the bullying can happen in the workplace. Hindi lang yan sa school nangyayari. Hindi lang mga bata ang binubully because I have encountered some cases of bullying in the workplace. Ang nambubuli yung mga bagong empleyado, no, ang mga binubuli yung mga lumang empleyado simply because the new employee is connected to the boss, no? So nakakalungkot mangyari 'yon. And then I already mentioned about the mandates. And while we are relying on and waiting for these issuances to preserve our mental health in the workplace, let's do something about our own sanity, our own mental health. So ano ang pwede nating gawin para sa ating sarili? Diba? How do we improve our well-being? How do we take care of ourselves? So we will not solely rely on our organization to take care of us carers, no? So dapat pangalagaan din natin ang ating sarili. So how do we do that, no? How do we do self-care? So define natin ang self-care. It is any activity that we do deliberately in order to take care of our mental, emotional, and physical health. So maling notion na pag sinabing self-care, physical lang yon. Pinangangalagaan mo ang iyong katawan. So it's not only physical but also our mental and emotional health. Take note of the word deliberate. Sinasadya mong gawin, no? Hindi yung kung kailan mo lang maisip. So, #intentional na siya, no? You deliberately do that to take care of your mental, emotional, and physical health. And that is self-care, no? Kasi on the premise that we cannot take care of people, we cannot continue to take care of people if we don't take care of ourselves. If our well-being is not taken care of, no? Madalas mo marinig yan you cannot pour from an empty cup, no? So kailangan you fill the cup. Okay? So these are the types of self-care and these are nice to know. So kaya ko sinasabi, ang self-care, hindi lang siya physical. Yung nutrition natin, we eat nutritious food, no? We exercise, we do stretching, we pay attention to the rest and sleep that we get, no? So yan yung physical care. How about the emotional care? Ayan yung mga how do we manage our stress? Ano yung mga coping skills natin? Are our ways of coping adaptive or negative? No? So maraming pamamaraan dyan. Some I'll be mentioning later. No? And even social self-care. Please take note that the word boundaries have been repeated 3 times in this particular slide. Kasi kailangan tayo mag-set ng boundaries. No? Yung relationship natin, dapat din may boundaries. Yung social media natin, dapat din may boundaries. No? We keep we should be connected with our family and friends. Yun yung social self-care natin. That even if we are limited to a face-to-face connection now, we can make use of technology to our advantage or even connecting screen to screen. No? So yan yung social self-care. And of course, yung spiritual self-care, our relationship with our supreme being, no, regardless of religion and the name you call your God. So dapat attune tayo sa ating relationship sa ating creator, no? And even with nature, no, we meditate, we pray, we have our me time or time alone that is spiritual. And of course, yung personal self-care. So, ito yung ginagawa mo exactly for yourself, na yung na-enhance mo ang iyong creativity, yung mga hobbies mo, no? Nagagawa mo, you go back to your old hobbies, you develop new skills, you make some new hobbies, no? Which I'm doing. Example ko lang, no? Nung bata pa ako, sanay na kami ng mga maraming plants, no? When I was a kid. So, when I got married, so nag-alaga ako ng mga roses, orchids, pero when I got busy with work, hanggang napabayaan na yon. At the start of the pandemic, I started na working on my garden. So hindi naman malaki, alam niyo naman sa syudad, hindi malaki yung ano namin, yung solar namin. So it's occupied by the house, meron lang sa harap. So I had a roof deck garden, no. So yung garden ko, so I enjoy really attending to my plants, repotting, etc., etc. So that's my personal self-care, no? And then yung safe self-care natin, how do we take care of our environment? Nagde-declutter ba tayo? Usong-uso ngayon ang salitang decluttering, di ba? Do we clean our space? Do we make it orderly? So ngayon, kakapalit ko lang din no, mga lagayan ng condiments, no? Okay pa naman yung dati, pero parang yung gusto mo makakita ng something new and something mas maganda, something updated. That's what I mean, no? So working on a healthy, orderly environment, a safe environment, that's also self-care. And then financial self-care. How do we take care of our finances? Maayos ba yung budgeting mo o you spend more than what you earn, which is the tendency, no? I would just want to share, I stopped having credit cards siguro for 8 years na or 10 years na. Kasi parang napansin ko it's a source of stress for me. Ang sarap kaya kasi I'm an impulsive buyer, no. So parang ang sarap mag-swipe ng mag-swipe, 'di ba? Pero nai-stress ako, makita ko pa lang yung envelope ng bill, no. Sabi ko, ay nako, this is not supposed to go on. So binayaran ko, yung principal lang, bahala sila dun sa binayaran ko. And I stopped all my credit cards and it's working good for me. So I work on my budget. Kung may pera ako, diba? Extra money, I spend shopping, yung mga ganon. So yun, dapat may boundary ka doon, na? Okay. And then the work self-care. So this refers to our time management. Dapat meron kang work-life balance, no? Work-family balance, life-love balance. Mag-set ka ng boundary doon, no? So even if we have spillover on our work na nadadala natin sa bahay, it should not occupy our family time, no? Our personal time pag nasa bahay ka na. 'Di ba? Magandang reminder ang iba't ibang klase ng self-care. So I know you already had topics on stress management, pero pasadahan ko lang some few more, no? So there are ways to manage your stress. Alalahanin mo how you cope in the past, yung mga challenges mo in the past, na nalampasan mo yung mga stressors, no? Mga problema mo in the past. So ano yung naging effective doon? Was praying, no? Effective, nakatulong ang praying for you, nakatulong na you ask help from people that matters to you, no? And then yung rest, yung relaxation, no? Kahit sandali lang, take a nap, 'di ba? The food you eat, no? And then try to keep reasonable working hours so you do not become too exhausted. Okay? Kahit naka-work from home ka. Kaya kami, two of my daughters who are with me in the house, naka-work from home lahat yan. May kanya-kanya kaming station, workstation. So alam, even my apo knows that when I enter this room, Lola, do you have work? Because this is my workplace. No? When I go out of this room, iba na. Nag-change mood na. Nag-change ano na ako. No? Change mood na and change role. Remember that you are not responsible for solving people's problems. Do not be a problem solver, no? So you just help people to assist to manage their problems, pero wag mong pangarapin na isolve ang kanilang mga problema, no? And minimize your intake of alcohol, caffeine, and nicotine. So avoid SAD, no? SAD, smoking, alcohol, and drugs. These are stimulants. These are oxidants. So no matter how you take in antioxidants, if you consume a lot of SAD or smoking, alcohol, and drugs, this will counteract your antioxidants, no? And check in on fellow helpers to see how they are doing. And then ask them also to check on you. Yung salitang kumusta ka, 'di ba? Kahit sa Bisaya, kumusta naman sad gihapon, no? Kumusta man ka, 'di ba? This is very magical. Alam ninyo, being a psychosocial care provider, hindi ko alam, no, if I have hindi ko alam, blessing, no? Minsan may mga kinukumusta ako at the start of the day or at the end of the day. Alam mo, natsyempohan ko yung mga taong kinukumusta ko ay may mga pinagdadaanan, no? Konting chat lang and we both feel good about it, no? So, kumustahin nyo ang bawat isa, no? At kumustahin mo rin ang sarili mo. Talk with friends, loved ones, or other people you trust for support. Siguro naman may mga taong ganyan sa buhay mo, no? Kapamilya, kaibigan, kapuso, no, na napagkakatiwalaan mo, whom you can share your joys and your sorrows, your triumphs, no, and your failures as well. So, reflection points after helping in a crisis situation, no? This is also taking care of the carers. Ikaw yung gagawa nito. Talk about your experience of helping in the crisis situation with a supervisor, a colleague, or a coworker, or someone else you trust, no? Ito ginagawa namin within our team, eh. So, I manage, as I've said, no, when I was still active in service, I have a team at the National Center for Mental Health. I stay in connection with the different psychosocial teams na na-train ko nationwide, no? So we check in on one another. Acknowledge what you were able to do to help others, even in small ways. Kasi when we practice, I just want to share this to you. When we do kindness, no? When we practice kindness to others, in a way, we also do self-kindness. When we show compassion to others, in a way, we also practice self-compassion. Di ba, when we do something good, we feel good. And when we feel good, we also look good, no? Kasi kahit na may edad ka na, it doesn't show in your face. Yung glow, iba. No, pag nakakagawa ka ng maganda, kesa nambubwisit ka ng ibang tao, no? And learn to reflect on and accept what you did well, diba? And what you did not do well, no? So may mga limitasyon kasi tayo. So siguro, what went well today and what needs to be improved. Pwedeng ganyan, no? And then take some time, if possible, to rest and relax. I will always say, mamaya, babanggitin ko yung 4 hours, no? Yan. If you find yourself, eto na yung medyo negative na ang mga effects sa'yo ng mga pinagdadaanan mo, no? Kung meron ka mga upsetting thoughts, hindi mo nakakalimutan yung mga nagawa mong, napagtulong mo sa mga difficult situation, no? Nahirapan ka mag-sleep, affected na ang appetite mo, you tend to consume na alcoholic drinks, no? Get support from someone you trust, no? Or speak to a healthcare professional or a mental health specialist, no? Especially if this is persistent, more than a month na, no? Or if this is already affecting your relationship with other people, or this stress reactions are already affecting your functioning. So yung tatlong bagay, kung persistent siya, kung affected na ang functioning mo, or kung affected na ang relationship mo with the people around you. So pwede nating malaman or pwede nating ma-consider na baka something is wrong, no? Okay. So caring for yourself is not self-indulgent. It is an act of survival. And that's according to Audre Lorde, who is an expert on self-care, no? So ayan, sinasabi ko, you cannot pour from an empty cup. You have to take care of yourself. You have to fill your cup, no, every now and then. And this is also a good guide, no? Self-care can be one, asking for help, no? So it will not make you a less person if you ask for help, 'di ba? Pwede bang pakibukas mo 'to? Pwede ba ganun ang role ng husband ko sa aking gardening, bubutasan yung mga pots na walang butas, 'di ba? He helps me in repotting. Hindi nakakabawas ng pagkatao mo 'yon. Spending time alone. So dapat may me time ka, no? Putting yourself first, 'di ba? So minsan bigyan mo ng prioridad ang iyong sarili. And asking for what you need. Do not expect people na anong tawag dito? Ma-anticipate ang pangangailangan mo. Ask for what you need. And then setting boundaries. So nasasabi ko na yan, work-life balance, work-family balance, love-life balance, dapat merong ganon. And then staying at home. We're doing this a lot now. Saying no. When you, it's also self-care when you can say no. No? Hindi ibig sabihin na hindi ko gagawin yan, ayokong gawin yan. But saying no may mean asking for a reinforcement. No? Boss, hindi ko po kaya mag-isa to, baka pwede mo akong bigyan ng kasama, no? Or saying no may also mean asking for an extension of a deadline. Hindi ko po kayang masubmit tomorrow morning, pwede po bang noon time or in the afternoon? Hindi po kaya ng powers ko, no? That's saying no. And then forgiving yourself. Sometimes we are so harsh on ourselves that we have a lot of negative self-talk. No, kasalanan ko, ang tanga-tanga ko talaga. No, you have to forgive yourself. Hindi naman tayo perfect, no? So you can always do better the next time. And taking a step back. Huwag abante ng abante. Sometimes aatras tayo, no? Kasi baka hindi maganda, baka hindi delikado. Baka delikado. No? Take a step back. 'Di ba? Ang ganda siyang guide, no? Krista, okay pa ba ako? Audio, video?
Yes, we can hear you clearly. This is actually a very interesting pointers po.
Hallelujah. Thank you. Okay. So some more tips. Mukhang 10 ito 10 tips, no, for self-care. Eat healthy and delicious food you enjoy. Diba? Since we were kids, sinasabi sa atin, eat nutritious food. No? At mamaya, no, when you are already comfortable, no, you can Google, thank God for Google, no, stress-busting food. Maraming pagkain na nakakabawas ng effect ng stress sa atin, no? Hindi siya nakaka-prevent ng stress, but it helps deter the effect of stress, mitigate the effect of stress on us. So ito yung dictum dyan. The yellower the better, the greener the better. So kayong nasa probinsya, you can easily access on this food, no? Yung tablia, dark chocolate, yan ang tunay na dark chocolate, yung tablia, 'di ba? My supply of tablia comes from Butuan and Agusan del Norte. Thank you, Mary Fe Nunez of CHD 13, no? Si Feng, yan ang supplier ko. And one from Agusan del Norte, si JV, no? Pagaran. So, yan. Sila yung supplier ko. And sometimes people from Cebu. So, yun ang dark chocolate na tunay, no? Ang ganda niyan as a stress buster. So, yung nakikita nyo dyan, tuna, mackerel, maganda yan. Nuts also, yung nuts. Ang dami namang nuts sa Pilipinas, diba? Iba't ibang klase ng nuts meron tayo. Even the act of shelling off the shell, the nuts pala, yung inaalis mo yung balat, no? That is already therapeutic because it silence our inner monologues. Diba? Kahit sa mga lamay-lamay, diba? Ang mga bilar-bilar, di ba, may nagsiserve ng nuts because nakakaalis ng stress. Habang nagkukwentuhan kayo, you forget about the dead person. Ang concentration mo doon sa nuts na you click it in your teeth, at nakukuha mo ng buo, it silence your inner monologue, no? And of course, milk, not only of the tryptophan in milk, no, which gives us a calming effect, but it psychologically, it dates us back, no, it brings us back to the day when we were babies and we are being nursed by our mothers, no? So take a walk while practicing mindfulness. Ito yung mindful walking, no? Ang mindful walking, you feed your senses. Habang naglalakad ka, napakaganda. Take advantage of you being in the province, no? Mag-walk ka and feed your senses. Ano ang nakikita mo? Yung greeneries, diba? Yung tubig, diba? Yung mga falls or what? Yung napansin mo ba yung kapitbahay mo nagpa second floor na pala o napa third floor na, daan ka ng daan, no? 2 months na palang ganon, hindi mo na notice, no? Kasi hindi ka mindful of the here and the now. And that's what mindfulness is. To be mindful, to be aware of the here and the now, no? You don't mind about your worries, you don't mind about yesterday or the future, but you are mindful, you are aware, you are attentive of the here and the now, and very effective using your 5 senses. So when you walk, tingnan mo, ano yung nakikita mo, naaamoy mo, ano yung mga naririnig mo, what you can taste, di ba? What you can feel. So yung haplos ng hangin sa iyong balat, no? So take note of the 2 words, mindful, when your mind is full about everything and anything, and when you are mindful of the here and the now, di ba? And then this is also a good representation. Spend time with positive people. Ang pangit na ngayon salitang positive. Spend time with people who brings out the best in you. Na kahit you feel ordinary, you feel extraordinary when you are with these people, no? Kasi na-appreciate ka, nabibigyan ka ng importansya. And I hope this happens in the workplace, no? So relax with a warm cup of coffee or tea. We have been reading about the different benefits of coffee, no? This is an antioxidant. Tsaka yung there are certain tea which gives a calming effect. Yung mga chamomile, lavender, green tea, no? If we consume coffee and tea within the day, some have 3 cups, okay lang yun, no? Okay. And the art of journaling is an art of self-care. Sa mga may edad, diary lang naman tawag natin dyan ngayon, no? According to an expert, a psychiatrist, my best boss ever, Dr. Benny Vicente, no? Yung ano yung benefits na nagjo-journal ka? Ano yung effect nun? Kasi inaalis mo siya sa sarili mo at nililipat mo siya sa kapirasong papel. Sa papel, no? So halimbawa, what you can journal, your worries, your goals, your problems, ang mga stressors mo, what are the things you can be grateful for each day, no? Yun yung pwede mong i-journal eh. Pwede, kung hindi ka naman magaling sa words, you need not naman make an entire paragraph. Pwedeng isang word, ikaw lang nakakaintindi. Or a dot on that page. Or use colors, no? Ikaw lang nakakaintindi. But what is therapeutic here is your expression, your ability to express what is within you, what is inside you in that journal, no? Okay. Go on an adventure. Para sa akin, ang adventure ay hindi pumunta sa ibang lugar, hindi pumunta sa mga iba't ibang lugar. An adventure for me is trying new things and doing it successfully. And even if you are not successful doing it for the first time, no? Ito yung goal mo eh. If I do this again, dapat maging successful na ako. Diba? So that is go on an adventure, which is tip number 6. Tip number 7 is listen to your favorite music. Yeah. It's proven scientifically how music changes our mood, na. So ako in stress management workshops we do, nagpapa-meditate kami, we make use of meditation music, and ang favorite namin is the Jim Chappelle, na yung Night Songs and Lullabies. There are a lot of meditation music in YouTube, which can choose from, no? When I have difficulty sleeping, initiating sleep, ako yung taong hindi mahirap makatulog eh. Masa ako eh, masandal lang tulog ako eh. No? But at the start of the pandemic, since the start of the pandemic, there are days, especially if I worry about my family, no, ganyan. Nahihirapan ako mag-initiate ng sleep. So what I do, I meditate. I do deep breathing, I meditate, and I play meditation music. Meron sa YouTube yung 2 to 3 minutes na sleep-inducing. Totoo, no? It is helpful. And in my garden, I also play my favorite music. Hindi naman ako heartbroken. I have never been broken-hearted, pero paborito ko yung mga kanta ni Moira, no? Particularly yung Paubaya, parang mga pang broken-hearted eh. Gusto ko yung melody, no? Gusto ko yung melody, not necessarily yung music. So merong Bluetooth ilaw doon sa garden ko to. So ina-attach ko lang sa phone ko, and then habang nag-garden ako or nakakaupo lang ako doon, yun, nagpe-play ng music. So try that, no? Yung mga ngayon, may mga nakaka-produce pa nga, nakakapag-compose pa ng music, their own music, or you can play your instrument, no? So kung hindi ka naman player, hindi ka naman songer, hindi ka singer, then you can just listen to music. It really alters your mood. Take a break when you need one, no? Yung nap time natin, no? Siesta yan nung unang panahon, no? Pero kahit 5 to 10 minutes lang, sandal ka, kahit nasa office ka, sumandal ka, close your eyes, i-rest mo yung back mo, no? And then deep breath. Okay, pwede ka mag-listen sa music. That will energize you, no? Revitalize you. And also the use of aromatherapy. Sabi ko nga, just feed your senses. So kung yung mga nababanggit ko, puro 5 senses dyan. Ngayon naman, yung ating sense of smell, no? Yung aromatherapy, scientifically din, nababago ng mga naaamoy natin ang ating mood, no? So pwede yung mga scented candles, yung mga paborito nating bath and beauty essentials, no? Ngayong pandemic, nagagamit ko yung mga regalo na lotion, 'di ba? Or yung mga shower gel, 'di ba? Iba-ibang amoy, nakakatuwa. No? When you come out of your shower or your bathroom, iba yung pakiramdam mo trying new scents every day, na? Okay, saka nakaka-change ng mood 'yan. So meron akong diffuser din, so at night time I turn that on. And then read a good just for fun book. I understand, hindi naman lahat ay mga book reader, no? So pwede natin siyang ma-translate sa watching, no? Watching your favorite movies, 'di ba? Ako kasi pag nanonood ng Netflix, and even nung may sini-sini pa, ang pinanonood ko lang talaga Tagalog, no? Ayoko yung mga horror, gusto ko yung mga ano lang, romance, mga ang tawag doon, rom-com, no? Yung mga ganon. Gusto ko yung mga ganong palabas kasi it makes me feel good. Kahit corny pa yan, no? Yun ang mga just for fun, no? Either read or watch. Okay? So, ayan. And then, actually, patapos na tayo. I just want to share to you some mental health care tips for frontliners. I did this, I came up with this early last year, na hindi ako nag-work, hindi ako nagre-report sa work. So in partnership with the Philippine Mental Health Association, kasi nag-volunteer ako sa kanila. So yon, the importance of taking a power nap, iidlip tayo, no? Kahit 10 minutes, 15 minutes each day. And it's important we connect with our co-frontliners kasi kakayanin kapag sama-sama, no? Connect with your family and friends. I have repeated that over and over again. And create a culture of affirmation, no? Masanay tayo nag-i-affirm tayo with one another, whether you are a boss or a subordinate, no? Kung ikaw ay boss, a pat on the shoulder, no, ng mga taong nagtatrabaho under your command, no? Ay malaking bagay. And even if you are the subordinate, magpasalamat ka sa boss mo. Sir, thank you. Salamat sa kape. Kahit 3-in-1 pa yan. No? Sir, thank you. Na-appreciate mo yung report ko. So, that's a culture of affirmation. There are agencies last year na ano ko, yung parang na-convince ko sila to come up with an affirmation wall. No? In BJMP Region 6, lahat ng jail merong affirmation wall. So, as in wall talaga. And they can write things on there. Yung isang hospital din sa Region 6, no? Yung Corazon Locsin, sa mga wards, meron silang affirmation wall. They can write affirmation notes to one another there. So maganda kaya yung na-appreciate ka at na-affirm ka sa mga ginagawa mo, no? And then take care of each other. Yung sinasabi kong kumustahin ang bawat isa. And it's okay not to be okay. So this is an overstated statement, no? Normal na makaramdam tayo ng mapagod tayo, gikapuyan na ka, 'di ba? You become frustrated, maglagot ka, 'di ba? Mahadlok ka, 'di ba? And that is just normal. It's okay to feel that. Huwag mo lang talagang tatambayan, no? As in naiinis ka isang buwan na, no? Galit ka sa boss mo isang buwan na din. So do it on a day-to-day basis. And then do not forget your health, not only physical but your mental health as well. And last but most important, no, believe that you have a strong God, stronger than this unseen enemy. Diba? And this is another PubMat I made or in partnership with the Philippine Mental Health Association, no? Sumunod sa tagubilin ng mga eksperto sa kalusugan, huwag tayong magbibu-bibuhan na naniniwala sa mga fake news, no? Paano na-address ang COVID-19, no? Paano nagagamot? Huwag agad maniwala o marinig sa mga nababasa sa social media. May mga fake news talaga. You have to verify that from reliable sources. Maging maalam sa mga wastong kaganapan. Let us be informed of what's happening, panatilihin ang ugnayan at samahan among friends and relatives. Buhayin ang bayanihan ng Pilipino. So very Filipino ang bayanihan. That even the IATF Bayanihan Act of 2020 was named after that important virtue of the Filipino. Kilalanin at pahalagahan ang sakripisyo ng mga health workers. So, never before that our health workers, our frontliners have been appreciated, affirmed, no? So, nakakatulong yon to boost their morale. No? Gumawa ng mga gawain na makakapagbigay kasiyahan. Yung mga feel-good, no, activities, no? Yung mga nabanggit ko na yon kanina. And then ibahagi ang mabubuting gawa. May mga nagpo-post sa Facebook, wag nating isipin na nagyayabang sila. Because they do that, anyway, that's their wall. They do that to affirm themselves and maybe to inspire other people. No? Tingnan niyo yung community pantry. Kung hindi ipinost yun, di malalaman ng mga tao yun. Diba? At hindi ma-emulate ng ibang lugar. And then of course, nandyan palagi ang praying. Okay. So make your own self-care checklist. So this is one start of self-care, no? Na pwede nating ilagay sa ating phone, pwede tayong maggawa ng checklist Paano mo pangalagaan ang iyong sarili? It's just like this, no? Or meron kang self-care menu. No? Mukhang wala dito yun sa slide ko. Meron kang self-care menu that each day meron kang dedicated na gagawin para sa sarili mo. On a Monday, read a book. On Tuesday, watch Netflix. On day 3, no, play with my pet. On day 4, yung mga ganon yung self-care menu, no? And here are some more self-care reminders. Let's be kind to ourselves, no? Nobody else will be kind to ourselves than us. Okay? Ourselves, our body is our best friend. So let's take care of our best friend. Say yes to meeting a need. Kung may kailangan nga ka, no, go for it, no? I-achieve mo yon kung may pangangailangan ka. Pay attention to how you talk to yourself. Negative versus positive self-talk. I-affirm mo din yung sarili mo, di ba? Ang galing ko, okay yun, di ba? Pause and take really deep belly breaths, no? I do that. I place my hand on my right, on my chest, no? And then my left hand on my belly. So pag magdi-deep breath ako, kanina nakita niyo yung video, no? Ang dami kasing pamamaraan ng mindful breathing, deep breathing, no? So inhale ka lang deeply, no? Kita mo gumagalaw ang iyong belly, and then siguro mga 4 na counts, and then exhale slowly. Gumagalaw uli ang iyong breath, no? Ang iyong shoulder, okay? Nararamdaman mo even your heartbeat. Cheer yourself on, no? Kung nag-cheer ka ng ibang tao, no? Good job, no? Well done, galingan mo, bilisan mo pa, no? Mas gandahan mo pa, 'di ba? Be gentle with your feelings, okay? Don't be harsh on yourself. Do one thing that makes you really happy, no? Kung gardening man 'yan, kung baking man 'yan, go for it, no? And then love yourself the best way you can. As I've said, you are your best friend. So more care tips for carers, take one day at a time, isa-isang araw lang. Ako ganun ginagawa ko eh. Hindi ako masyadong nagwe-worry about next month. No? Araw-araw, yun, i-achieve natin yung day-to-day basis. Make a list of friends or relatives that can help you. So, sino yung una mong tatakbuhan? Or keep a diary of issues. Yun sabi kong journaling, no? Ask friends or relatives to prepare meals for you, para kung hindi mo kaya, pagod ka na, or pwede kang mag-order. Ginagawa namin yan para makarest yung aming cook. Pag weekends, nag-order na lang kami. Ask a friend to stay overnight. No? Although ito ay mahirap mangyari ngayon dahil sa takot natin sa virus. Discuss flexible work options with your employer. So uso naman ito ngayon. No? Nagpapalitan ng trabaho, MWF, ganyan. And then get someone to do your household chores. So nag-generate ka pa ng ano. So yung meron naglilinis ng garden, may naglalaba, pwede naman ganon. No? Exercising health protocol. Give yourself regular rewards. Ayan, bibili ako ng plant sa weekend. Hindi ako dapat lalampas ng 1,000 sa mga namamine ko. Ako yun yun ang reward ko sa sarili ko. Or after each webinar, hindi naman each kasi ngayon halos araw-araw, no? Nagmi-milk tea ako. So ngayon medyo na-challenge ako technically, no? Kabisado ko yung lecture ko pero na-stress ako dun sa technical aspect eh. Magmi-milk tea ako mamaya. Okay? So, I like this image, no? Kasi dinidilig natin ng ibang tao, sila yung nag-grow. So, dapat dinidilig din natin ang ating sarili. So, we will as well grow, no? And we charge our gadgets, no? Let's also recharge ourselves, no? Para hindi tayo ma-empty bat, hindi tayo ma-low bat. Let's make self-care our priority. So just like a car na kailangan ng gasolina para umandar, no? Ganun din tayo. Para to keep us going, no, we have to pay attention to our well-being, and not just when we remember it, but it should be on a daily basis, no? Remember that the COVID-19 response is not a 5-kilometer run, no? This is a long distance race. This is even matirang matibay, no? So let's brace ourselves. So I hope there are managers and supervisors here. I just have some few slides. So these are some few tips for you, no? Encourage staff to engage in self-care activities. Pero dapat minomodel mo yon, nakikita din ng mga staff mo yon, yung kindness na papakita mo, no? And then you capacitate them. So having this is also one way of capacitating this, no? They attend webinars, no? And then provide accurate, up-to-date, easy to understand information and staying safe. Like ngayon, alam natin na ang Delta variant is already airborne, no? Kasi noon sinasabi hindi naman airborne, kaya dapat hindi tayo talaga nag-aalis ng mask, especially when we are outdoors, no? And then yung body system, peer support, maganda kaya meron kang kabady, meron kang kapartner sa trabaho mo, kesa nagsosolo ka lang, no? Dapat meron din tayong mental health program for our staff. Tapos yung open door facility, di ba kasi meron tayo yung doon ka magre-report sa boss mo, yung direct superior. But sometimes your direct superior is your problem. So siguro pwede kang mag-file ng grievance to another supervisor or the next higher authority. And then work to proactively address conflicts, yung mga supportive team environment, di ba? Yung maganda yung relationship ninyo, show kindness and compassion towards one another, no? So ito yung sinasabi ko, this is not only applicable to your team in the workplace, but you also have your team bahay, no? Take care of your team bahay. Practice din natin ang 4 hours. Ito yon, no? Rest, recreate, no? Ito yung mga feel-good activities, recreation. And then reflect. No, reflect on what you have been doing, saan ka nahirapan, saan ka mali, saan ka magaling, no? And then reflecting also will include meditation and praying. And then recover. Give your body time to recover. Okay? That's the 4R. Remember, now looking after yourself and your team member is not a luxury. Hindi naman ito magastos. Hindi ka mababawasan, but it is your responsibility. Let's be kind to ourselves, no? Self-care is always a goal, no? Let's not aim for perfection. We may try other self-care activities so we will make progress each day, each week, each month, no? Until we find what best suits us. Okay? So let's practice self-love, self-care. No one else will do that, no? Kasi tayo yung may control niyan, no? Let's affirm ourselves, no? Sabihin mo sa sarili mo as you hug yourself, do self-hug, no? Pwede 'yon, self-hug. You just cross your arm and then squeeze your forearm, squeeze it hard. And then affirm mo yung sarili mo. Ang galing mo, ang tapang mo, ang ganda mo, mahalaga ka, you are special.
Hi, Ma'am Thelma. Sorry to cut you off in the middle of your discussion. Nawawala po kasi ulit yung audio ninyo.
Sandali pa lang naman. Okay, sorry.
Yes.
Sana ko narinig here. Narinig ba ako here?
In the very same slide, yes po. Opo.
Ayan. Ang ganda nito, di ba? Caring for yourself is not me first. It is me too. Di ba? Hindi yung ako muna. Pero ako naman. Di ba? So, bisayain nga ninyo yan. Hindi ako usa, ako sad. Di ba? Ganda, no? And then also remember to take care of yourself. Sometimes we're busy taking care of others. Nakakalimutan natin na mahalaga din tayo. Siyempre pag wala na tayo, paano na sila, 'di ba? Be there for yourself so you can be there not only for your clients you serve but also for your loved ones, no? So ayan, remember, this will always be a reminder for all of us. Nasa gitna tayo ng pandemya, no? It is stressful. Let's be kind to ourselves, no? So marami pong salamat, daghang salamat sa inyong tanan, Caraga Region, my beloved Caraga Region. I have a lot of friends and mga anak ni TSB in Caraga Region. Daghang salamat sa opportunity. Weng, Fabia, and DOH, CHD, Region 13, daghang salamat kaayo. And of course, for the tech team, To Cristel, ayan, parang nanalo ako ng ano. Ay, I'm done, I'm done.
Yes, Ma'am
I'm
Thelma,
done.
thank you so much for everything that you have shared with us today. Nakikita naman natin sa comments na sabi nila, you delivered such a beautiful and inspiring words, especially in the hard times. I think this discussion is really what we need. And of course, with the 71 viewers, meron tayo on Facebook. It's expected that we have questions. We receive questions via private message and we'll be flashing them on your screen. The first question that we have is, how can we identify that certain people around us is pretending to be our support system, pero pag wala ka na, they're spreading bad things about you?
Malalaman mo rin 'yan and rely on your gut feel. You will really alam mo yung mabaho, 'di ba? Sisingaw 'yan eh. So, lahat naman siguro tayo naka-experience na merong ganyan sa buhay natin, 'di ba? So, nagawan mo ng maganda pero naiinggit 'yan eh, naiinggit 'yan sa'yo. So, you will know that either on gut feel or maybe some people will tell you. So, pag ganon, I don't mind, no? So, yung mga taong nagmamahal sa akin know me better than whatever they spread around. So, ako ganon yung ano ko ha, dictum ko.
Mhm. Alright, so I guess totoo naman yun. We will always encounter those kinds of people, especially if you have a huge circle. It's very hard to
Yes,
it's
cannot
very
please
hard to
everyone.
identify who.
Mm-mm.
Totoo. Now, let's proceed to the second question po. What are your tips to the person in the quarantine facilities to prevent a depression? Kasi we have a lot of people having trouble with their mental health, especially if they're being quarantined.
Okay. Ay, ang dami naming tips diyan. Actually, as I've said, I'm in a core group on MHPSS, no. So, meron kami mga mabuhay kit, may mga brochures na dapat magkaroon kayo. So, for those who are managing ano tawag doon? Managing quarantine facility, dapat na-check in ang mga tao inside, no. From the time they enter the quarantine facility, unang-una yung basic needs nila. So kaya binibigyan ng mga kit yan eh, disinfection kit, mga ganun. Mas maganda meron silang something to write on, no? Tapos merong mga ano doon, 10 challenges. So halimbawa for day 1, acknowledge your feelings, mga ganun, isulat mo yung mga nararamdaman mo. Day 2, parang everyday, meron kang gagawin para sa sarili mo, 'di ba? Para ma-preoccupy sila. Ako kasi kasi nga yung sa nature ng aking trabaho, kung mayroon akong nalalaman na naka-quarantine, makikita mo naman sa post yan eh, 'di ba? Na parang mga ganun. Day 1, mga ganun eh. Kung minsan hindi explicit eh, no? So, chinechat ko yan eh. So, ito yung gagawin mo. Kahit hindi ka mahilig magsayaw. So, I hope there's a mirror in your ano, no? O kaya, ano mo yung cellphone mo, magsayaw ka dyan hanggang matawa ka sa sarili mo. Yung mga ganun. O do TikTok. Someone who I know is loving TikTok a lot. O mag-TikTok ka ngayon mag-isa dyan and wala nakakakita sa'yo. Maybe you can release that later on. You have a 14-day collection of TikToks. Yung mga ganon. Or yung maganda yung ano, yung as I've said, yung journaling. Yung ako kasi yung poetry, kahit hindi ka poet eh. So when you wake up in the morning, what's that first word, no? What's that first word that come first in your mind, no? Alam mo yung mga naaano ko yung buhay, 'di ba? Ma'am, ang naalala ko ngayon is buhay. Or ang naalala ko ngayon ay ang mama ko, mama, 'di ba? Tapos i-explore nila yung salitang yan, nakakagawa sila ng poem, tapos ini-share sa akin. Alam mo, nakakatuwa. And before you know it, tapos ang 14-day mo dahil. No. So, ganun yung maganda eh. So, for those who are managing quarantine facilities, I hope you'll be able to come up with that, no? Na mga ganon. At saka na-check sila araw-araw para maramdaman naman nila na kahit sila ay nag-positive dahil sila ay nagtrabaho, naaalala pa din sila ng mga boss nila. No? So, pwede yan eh. Kanya-kanyang paraan ng mga programa, but those are just tips. Thank you, Cristel.
So regarding that, parang the idea is for quarantine facilities to improvise programs for those who are quarantined. Opo.
Yes.
That's very interesting kasi parang if ikaw naka-quarantine, wala ka namang maisip na gawin. So if there's a program for you to look forward to every day, parang it's less of a burden.
Yes, dapat pinag-uusapan 'yan, dapat pinaplano 'yan, and also it depends on your resources, no, budget. Kaya mo
True.
bang gumawa ng mabuhay kit? Kasi as in nagbibigay sila ng isang kit, bag ba 'yan, mga kung lalaki, blue, kung gano'n, nandun na din yung small notebook, may pen or coloring pen or crayons, depende 'yan. And Caraga will always have that, no, maganda yung resources ng Caraga, I'm sure of that, no?
Hey, thank you, ma'am. So that was the question for the second question that we have. Now we're going to tackle another question here. This pandemic has brought mostly of the children addicted to gadgets. Totoo yan. Parents have now difficulty moving it away from them. So how can we deal with that, or how can we distract the kids?
Yung distract ay nakakatakot, distraction, but it's be distract, no? So alam natin na may mga positive, okay. I just want to say may positive at negative effect ang ano natin, tawag doon, our indulgent, hindi ba ako nawala? Our indulgent to social media, no? May positive 'yan. One positive is we get connected, no? At nagiging source 'yan na tayo ay nakakapag-share, no? Nakakapag-share ng ating emotions through social media. Pero yung negative aspect niyan, yun nga, you get addictive to it, no? So kailangan tayo yung, lilimit yung screen time, no? So halimbawa, or make it as a reward, kasi ganun yung nakikita kong ginagawa ng mga anak ko sa mga apo ko, no? So if you do this, nag-pack away ka, or you're done with your schooling, or may mga house chores ka na dapat mong magawa, you have an hour in Roblox, no? Yung mga ganon So pwedeng ganon, kasi you can always set that. Tapos, indulge them in mga activities, mga shared activities. Like, dapat may schedule, no? May schedule din. 30 minutes play kayo with your, ganon, no? Nasa yan nasa control ng magulang. Do not be persuaded by the mga kagustuhan ng anak ninyo. But dapat kasi nakokontrol yon, no? Marami kasing negative effect than positive effect, no? Being hooked to gadgets.
Yes, totoo. It's a challenge, but I think totoo yung sinabi ninyo. We as parents should not be persuaded. But in fact, dapat tayo yung nagtutulong sa kids natin on controlling their screen time.
Yes, and you can do that.
Now we have our next question. It's from Facebook. How do you cope up po in reality after you've been isolated in a quarantine facility?
Yeah. Ito isang malaking challenge din, no? So, I don't know if na-quarantine ka dahil nag-intay ka lang ng result or swab, or na-quarantine ka kasi positive ka pero wala ka namang symptoms. So, iba-iba yun di ba? Iba-iba rin yun. So, depende yun sa'yo. But if you have been infected with COVID, pwede kasing may mga effects later on, no? So, you have to manage that. Dapat yan na ma-manage. And then dapat din, so ano yung gagawin mo after, kasi you may have upsetting thoughts, no? Dapat ibibisi mo rin, i-distract mo rin ang iyong sarili, no? So busy yourself, gumawa ka naman, ang dami naman tips na nasabi ko na, no? And then that's one way, kasi yung upsetting thoughts will always be there, no? So, kailangan ay magawa ka ng paraan na mawala yon, and then maganda rin siguro practice gratitude, which is an attitude, no? Be grateful na lampasan mo yon, 'di ba? Kasi meron namang ibang hindi nakakalampas sa quarantine. Question?
Opo. All right, so thank you so much. I guess that's a very practical tip. Now, another question is related to practicing self-care. How do you encourage individuals who are reactive emotionally to relax and practice self-care?
Kinokontra ka ba? Yung parang, nega? Parang ganon, nega, no? So, as I've said, kasi pwede namang, yung self-care kasi ay pwedeng what suits you, no? Pero para sa akin, kung ikaw yung nag-i-encourage ng tao, ikaw yung mag-set ng example, no? You set the example, tapos isama mo siya no? Until ma-feel niya yung benefit noon, and then pwede na siyang gumawa on her own or on his own. So, yun. Be an example, no? Or yun, ano mo muna siya, engage mo siya together with you, no? Hanggang maramdaman niya, maganda pala to. Okay?
Right. Well, I guess that's why it's important that all of us becomes advocates for mental health, because sabi ko nga kanina before we started, it's actually a role that every one of us has to play. So I guess that's good, being an example.
Yes.
So next, we have another question. I think this is still related to self-care. Now, some people say that self-care is only for the rich and privileged. Why do you think they have to do it? How should rich people do it? I guess a lot relate to this.
Oh, ay, ngayon ko lang na-encounter tong ano na to. If you can remember what I shared, hindi naman siya pang mayaman, di ba? Hindi naman siya pang sinuswerte sa buhay lang. Yun ngang paghinga, mindful breathing, mindful walking, is it for the rich and the famous only? Hindi no? So there are a lot of things na hindi mo kailangan ng pera no, for you to be able to practice self-care. Kahit Tagalogin mo pa yan, Bisayao na nimo, unsa ang self-care, di ba? How do you take care of yourself? So you need not have money. You need not be privileged to be able to do that, no? Para-paraan lang 'yan, no? And I already gave some tips. So I hope we'll be able to dispel that notion that it's only for the rich and the privileged. Siguro kung ang gusto mong self-care, mag-indulge ka in sports like golf, di ba? Or kayaking, mga ganyan. Yun siguro, mahirap, no? As I've said, ang swerte nga ninyo sa probinsya, dali na kayo mo makaanaog dagat, di ba? O tulong ka sa dagat, doon ka sumigaw, wala kang mask, di ba? That's already self-care, no? So how I wish nga makapunta kami diyan, may mga kami dagat goal nga kami kaya nagche-check ako kung safe na ba, mga ganon. You take advantage of nature, no, of your place. So hindi mo kailangan ang kayamanan, di ba?
Take advantage of the resources you have and the place around you.
Yes, and we have a lot of that, no? Swerte kaayo ta.
Opo. So I guess that was our last question for today. Thank you so much po. I just wanted to read a few comments for you kasi I think you deserve to hear the very positive comments online. We have a comment from Venus Ralias. Thank you, Ma'am Selma Singson Barrera, for your advice. It really helped me a lot during my isolation period. I do deep breathing and art journaling. That's very nice.
Yan. Oh, I know Venus.
Talaga?
Yeah, Venus is a very good member of the psychosocial team. Very active na siya.
That's good. We have another comment as well from Radaza Crisel. Super tama po. Grateful for another chance ng life. At yung diary lang to, o daghang jokes, mga happy things. She also mentioned tagos daw sa bones ng ibang mga i-share.
Unsa daw?
Tagos sa bones.
Ayos sa bones.
Yes. I think that's because you delivered very practical insights on how to deal with stress, being quarantined, anxiety. Rosel
yan yung lolo.
We only live once, so live life with a purpose, be happy, and keep the love alive.
Oo, di ba yan ngayon yung YOLO? You only live once. Oo.
I think YOLO applies to taking care of ourselves, no? So I guess it's very important now. I hope our virtual audience understands how it's important to work in time first. Sabi mo nga kanina, Ma'am, it's not me first, but me too.
Yes, di ba? Cute nun?
Yes, it's very nice.
Thank you, DSWD. Alam, malapit din sa loob, sa puso ko ang DSWD. Worth repeating, so let's repeat this.
Soon. You delivered a very nice discussion with us, Ma'am. Thank you so much. Again, we just finished discussing caring for carers, building one's well-being while serving others. It has truly been an honor to end our third day for the mental health series with you. The discussion is very, very nice and informative and practical. So at this point, we are going to present to you your certificate. Maraming salamat for joining us. The Republic of the Philippines Department of Health Center for Health Development, Praga, presents the Certificate of Appreciation to Thelma S. Barrera, RN, for sharing her valuable knowledge during the webinar series on mental health and celebration of the National Mental Health Week on October 14, 2021 at 9 a.m. via Facebook Live. Signed by our Regional Director, Cesar Casion.
Uy, si Director Cesar Casio na naman pala ali.
Yes,
Thank you,
yes.
sir.
Ma'am, thank you so much for being with us today. Sobrang marami po kaming na-learn today, and I hope that you're able to share your knowledge to other platforms as well. And even if we were challenged technically, still maraming salamat sa ating virtual audience for being patient with us and for staying with us until the rest of today's talk. So we have 74 viewers right now. Maraming salamat. This is the last day, the last session, the last live stream for the mental health series Advocating Care for All. Maraming salamat for joining us. Straight 3 days. Maraming salamat for the agencies who joined us and the schools, private entities as well. Thank you so much. It has been truly an honor. I would also like to thank DOH Caraga, Regional Director Cesar Casion, Assistant Regional Director sa Daila Raquel, LHS Chief Dr. Ernesto Pareja, MSD Chief Ms. Eileen Sacol, RLED Chief Dr. Glenn Tiangha, Non-Communicable Disease Cluster Head Dr. Agnes Calliantes, Regional Mental Health Coordinator Ms. Rowena Fabia, thank you so much. And of course to the entire Non-Communicable Disease Cluster and syempre naman for making this possible, the Health Promotion Unit. Maraming salamat po. I hope that as much as I've learned, kayo din po dyan sa mga bahay ninyo, sa offices ninyo, wherever you are, you're able to pick up a lot of things and be champions for mental health. Again, if you're going to share this live, please feel free to do so. Kasi even if hindi na po tayo live, a lot of viewers online can still replay this video. You can use the hashtag #YouMatter, #mental health for all. And of course, for the last time, we are flashing on your screens the DOH Historieta helpline. It's available 8 a.m. to 5 p.m. on weekdays except holidays. We have Smart and Globe lines, which you can call if you need someone to discuss to professionally. We have trained individuals who will answer your calls, and the conversation will surely be kept private for you. Ayan po. So once again, my name is Cristel Delmar, and I've been your moderator for 3 days. I've been so happy working with you, being with you, and talking to you for the mental health series. Thank you so much and have a great day.